This ginger ale tastes bright tonight.
You always notice small things when your mind is busy.
I have been reading about superbugs and it makes my stomach twist.
Tell me what part feels heavy.
I hear that antibiotics do not work like before and that scares me.
That fear is fair and many people share it.
What is a superbug in plain words?
It is a bacterium that learned how to survive drugs that used to kill it.
So the old tools fail and we run out of options.
Some tools still work, but they need careful use and new partners.
People keep saying viruses might help, which sounds strange to me.
Those are bacteriophages and they infect bacteria, but not people.
I like the short form phage because it is easier to say.
That is the common word, and it is fine to use here.
Can you explain how a phage works without fancy words?
A phage attaches to a bacterium, enters it, makes many copies, and bursts it open.
So it is very specific to the target.
Yes, most phages prefer certain bacteria and even certain strains.
That sounds helpful, but also tricky.
It is helpful because it spares bystanders, and tricky because you must find a good match.
How did people even think of using phages as medicine?
Scientists saw phages a long time ago and tried them before antibiotics were common.
Then we forgot about them when antibiotics arrived.
Antibiotics were simple to make and usually took center stage for decades.
Now the problem returns and the old idea gets a second chance.
Yes, and science tools are better now, so the idea is more practical.
What makes matching so slow?
Bacteria differ across patients, and a phage that works for one case may not work for another. This is why labs build libraries of many phages and keep records of what matches what.
Is there a way to speed that up?
There is progress with rapid tests and with machine learning that predicts matches.
So AI helps pick a phage like a smart guide.
It helps narrow choices, which saves time in a serious case.
How do we know it is safe for a person?
Safety depends on purity, dose, route, and monitoring, and studies watch those points.
Are there side effects we should be afraid of?
Many people tolerate phages well, yet care teams still watch for reactions.
Do bacteria learn to dodge phages too?
They can, which is one reason to use phage blends and careful plans.
What is a blend in this context?
It is a mixture of several phages so that one failure does not end the fight.
Could a blend also work with an antibiotic?
Yes, some teams use both because different tools stress bacteria in different ways.
I worry about the body's own helpful microbes when we use strong tools.
Phages are more selective than many drugs, so they may spare more helpful microbes.
How would someone even get this therapy?
Today it may be through a research study or special access with doctors and regulators involved.
So it is not yet a standard drug at the pharmacy.
Not yet, and guidance is growing step by step to support future access.
Where would the phages come from?
They come from labs that grow, purify, test, and store them with strict checks.
What kinds of infections are being looked at?
Hard lung infections, stubborn wound infections, and some urinary infections are common focus areas.
Why those in particular?
They are painful, persistent, and sometimes resist many drugs.
How does a doctor decide the route of delivery?
It depends on the site and the case, and routes can be local, inhaled, or intravenous.
If phages are so precise, do we need a test every time?
A test is wise because the good match gives the best chance.
Could AI ever make a custom phage for a person?
It may help design or select, and design ideas are growing as tools improve.
I want to understand what a study looks like in this field.
A study plans who can join, how to give treatment, what to measure, and how to compare outcomes.
So it is not magic or guesswork.
It is structured, cautious, and reviewed by many eyes.
What about timing, because infections move fast?
Teams try to shorten steps like diagnostic tests, match prediction, and preparation. This is where faster lab methods and data platforms make a big difference.
Can a person get better while the match is still being found?
Doctors can use supportive care and other therapies while they work on the match.
How long does a phage stay in the body?
It depends on the route, the immune system, and whether bacteria are present to support phage growth.
What happens if the infection lives in a slime layer?
Biofilms shield bacteria, and teams use phages that can break those layers or combine tools.
The word biofilm always makes me think of sticky trouble.
It is a common reason that some infections do not clear.
Do people ever fear the word virus because of past years?
They do, and clear talk helps show that
These phages are not aimed at human cells.
How do you build trust with a patient who is tired and scared?
You listen first to explain in simple steps and share what is known and unknown.
What is still unknown?
How best to standardize how to scale supply and which groups of patients benefit most.
Is cost a barrier?
Cost links to scale, regulation, and logistics, and better systems can reduce it over time.
What does regulation add here?
it adds quality rules, safety checks, and shared language for future approval.
Does that slow things down?
It can, but it also protects people and builds long-term trust.
If this becomes mainstream, what might change in hospitals?
Faster tests, shared phage banks, and teams trained to match and monitor could become routine.
A phage bank sounds like a library for care teams.
It is a store of options with data on which phage fits which bacteria.
Where does data come from in the first place?
It comes from lab work, clinical records, public studies, and careful follow-up.
Can misuse cause trouble like we saw with antibiotics?
Any tool can be misused, so training and guidelines matter from day one.
How does a person know if a clinic is responsible?
Watch for clear explanations, informed consent, monitoring plans, and honest limits.
Could this help in places with few drug options?
If supply lines and support exist, it may add choices where choices are thin.
What about the environment when phages are made and used?
Production aims for clean processes and disposal follows rules to protect water and soil.
Are there ethical debates here?
There are debates on access, fairness, and who pays when a therapy is still emerging.
Do you think people will accept that idea once they see results?
Clear results and kind care tend to change minds with time.
Could a person take a phage by mouth?
Sometimes yes, but stomach acid and the target site affect success.
So route is about getting to the right place at the right time.
That is the core of delivery science.
I get lost when people talk about genomes and sequences.
A genome is a list of instructions, and teams read it to avoid unwanted genes in a phage.
Unwanted genes sounds scary.
Screening removes phages that carry genes for toxins or other risks.
How do they prove purity?
They test for leftover cell parts, other microbes, and chemicals from the process.
This is more careful than I pictured.
Modern quality systems are very strict.
Does a person need to stop antibiotics before trying a phage?
Plans differ, and some cases use both tools with timing that avoids conflict.
Could a phage make an antibiotic work again?
Sometimes reducing the bacterial shield helps a drug do its job.
What if the infection is rare?
Rare cases can be hard, but data from similar strains can guide a plan.
How do doctors measure success?
They look at symptoms, lab counts, imaging, and how the person feels day to day.
What does failure look like?
No change in symptoms, no drop in counts or side effects that force a stop.
Is retreatment ever done?
It can be with changes to the blend or the route.
I want to know about timing again, because that worries me.
Faster tests, ready stocks, and simple logistics shorten the gap to first dose.
Standard workflows help a hospital move with less delay.
Is there a risk that a phage hurts helpful bacteria by mistake?
The risk is lower due to specificity, and labs test host range to check it.
Can you explain host range in clear terms?
It is a list of bacteria that a phage can infect, and narrow lists are common.
So we need the right key for the right lock, but without a metaphor I would say the right choice for the right case.
That is a fair way to say it without images.
How do we keep records straight when many strains exist?
We use naming rules, databases, and barcodes, and we repeat tests to confirm.
Does data travel across borders?
Sometimes it does under agreements that protect people and privacy.
You are calm when you say all this.
Calm comes from practice and from respect for careful steps.
What gives you hope?
I see teams learning from each case and turning lessons into better care.
What would you say to someone who feels lost?
I would say you are not alone and clear answers grow from simple questions.
Is this therapy meant to replace antibiotics one day?
It is meant to sit beside other tools, not erase them.
That balance feels mature.
Balance is what good care looks like over years.
How do insurance and payment fit into this picture?
They follow proof and policy, and both improve as evidence grows.
Would home care ever be possible?
Maybe for some routes, but safety checks and storage rules must be clear.
What storage rules matter most?
Temperature, light, time, and container integrity matter for potency.
Could people share leftover vials?
No, because quality and match are specific, and sharing would be unsafe.
What should a person ask their doctor if they are curious?
Ask about risks, benefits, options, access paths, and how progress will be measured.
What should a doctor ask a lab?
Ask for strain data, host, range, purity reports, and stability data.
What does success look like for society?
Less suffering from stubborn infections and more options when drugs fail.
What does failure look like for society?
Overuse, poor records, and uneven access would waste a good idea.
Who needs to talk to whom to avoid that?
Doctors, microbiologists, regulators, ethicists, and patients must talk early and often.
I sometimes feel small when I hear about big systems.
Small acts matter, like washing hands, finishing prescriptions, and asking clear questions.
So the everyday habits still count.
They always count and they add up.
I want one story I can hold on to.
Many people who faced long infections found relief when a careful plan used the right phages.
That sounds gentle and human.
Good care always sounds like that.
What is one common myth you hear?
A common myth is that all viruses hurt people, which is not true for phages.
What is another myth?
Another myth is that precision means it will work for anyone without tests.
So tests remain a pillar.
Yes, they guide the plan and protect the person.
Do people worry about long words and feel shut out?
They do, and it helps when experts translate those words into daily speech.
You do that well.
Thank you, and your questions make it easier.
I'm trying to learn without panic.
That is the best way to learn.
Can you explain how resistance to phages might appear?
Bacteria can change surfaces or systems the phage uses, so the phage cannot enter well.
How do teams respond when that happens?
They change the blend, change timing, or add another tool.
What if someone asks for this too early in a case?
Doctors weigh standard care first, then consider new options when needed.
Would you advise someone to self-medicate with phages they found online?
No, because quality, match, and safety checks are essential.
If a person reads a success story, what should they keep in mind?
Every case is unique, and one story does not replace a full plan.
Do you worry that hope can race ahead of proof?
Hope is good when it walks with honest data.
I feel calmer now.
Calm helps you hear details that protect you.
What details should I keep tonight?
Keep this list in mind, which is that phages are precise, tests matter, blends helps, and teams watch safety.
That is short enough to remember.
Short lists can guide hard days.
How does speed affect outcome?
Faster matching can mean less damage and less spread in the body.
What tools keep speed up?
Clear intake rules, ready samples, shared databases, and quick lab work keep speed up.
What keeps fairness in view?
Policy that supports trials and access can reduce gaps between rich and poor.
Are children and older people part of plans?
Plans consider age groups carefully and build safety steps for each group.
What about people with weak immune systems?
Those cases need extra watch and gentle dosing.
Could phages help prevent infection?
Some research looks at prevention in certain settings, but treatment is the main focus so far.
Can this work in animals too?
Yes, there is interest in animals and food safety, which also relates to human health.
That connects many fields.
Good health systems connect many fields.
If the plan fails, what keeps a person from losing heart?
Compassion, second opinions, and new plans keep hope alive.
I trust your voice when you say that.
I am grateful for that trust.
Do you think schools should teach this?
Basic lessons on microbes and careful tool use would help everyone.
I wish I had learned this earlier.
Today is a good day to start.
What would you tell a nurse who wants to help?
I would say record carefully, ask clear questions, and speak up for the patient.
What would you tell a pharmacist?
I would say watch storage, watch timing, and share what you see with the team.
What would you tell a lab tech?
I would say your tests are the map that others follow.
This sounds like a full orchestra, but without music words I will say a well-timed team.
A well-timed team is the heart of care.
Thank you for keeping this simple.
Simple words can carry deep truth.
I feel less afraid and more curious.
Curiosity is a clean light in a dark hole.
That image is soft and I can hold it.
I'm glad it helps.
One last thing about AI, because that part feels vague.
Think of AI as a guide that reads many records fast and suggests a short list to test.
So people still test the ideas in the real world.
They do, and that keeps science honest.
What do you do when results and hope do not agree?
You tell the truth with care and you keep looking for a better path.
Is tonight a good night for hope?
It is a good night for hope and for patience.
I like that sentence.
I like your steady spirit.
Thank you for the talk and for the space.
You're always welcome at this counter.
Good night, boss.
Good night, Claire.
I should head home now, but I just realized I left my wallet at the house and my heart sank. Since I forgot my wallet, would you please cover this ginger ale for me? I know you have been sitting here beside us and listening all this time, and if anything we said helped even a little, would you be kind and help me? Thank you so much in advance, and you can send a small tip using the QR code at the lower right of the video or the link in the description. Please tap like, hit subscribe, and leave a friendly comment if you can. You will also find links in the description to other works from a very different series. Thank you again for tonight, and good night.